Hi, everybody. This is Norm Devane. I am the Vice President of Marketing here at Copa Health, and we are well into May. I think Memorial Day is coming up this weekend, and I just hope that everybody is able to enjoy their time off, enjoy Memorial Day, think about what it's really about, and then also, get out there and spend some time with family or friends now that COVID has eased up a little bit. But hey, we have a great guest today, and I have known this man for a long time. Dr. Michael Franczak has joined us, and he is the Director of Population Health Management here at Copa Health. And Mike, I'm gonna have to ask you to make sure that I got that right, Director of Population Health Management. And we're going to be speaking with Mike about Mental Health Awareness Month. May is Mental Health Awareness Month. And as you know, Linda's been working on our campaign, which is 31 Days of Healing. A couple of weeks ago, we had the NFL Enlightenment series where we talked seriously about the prevention of suicide. And I know that we've got another effort that we just finished with a suicide prevention forum. And, Mike, how are you doing today?
I'm doing well, Norm.
It's so good to see you. So good to see you. So I know that you have done many, many different things, both at Copa Health, Partners in Recovery when the two companies were separate, and Mark Community Resources. And you were responsible for a lot of the things that happened back in the day with the state. So tell us a little bit about yourself. I don't know if you have to go back all the way to Pennsylvania, but how long you've been with Copa Health, a little bit about yourself, and exactly what population health is, and how does it help our members?
Well, Norm, I've been with Copa Health in both of its, components. I was at Mark probably for about 10 or 12 years, somewhere around there, and I was the director of the behavioral health section of Mark. As you know, Mark, Jewish family, and Recovery Innovations started PIR. So I was the chairman of the board for PIR for practically 10 years. But I've always been involved in PIR activities as well. So I've been around for a while. As you said, I originally from Pennsylvania, spent most of my life there. I worked for the Department of Public Welfare in Pennsylvania, so I traveled around the state to various hospitals. I then eventually got tired of traveling around Pennsylvania, so I started traveling around North Carolina for about 4 or 5 years. And then I came to Arizona, and I've been here ever since.
Are you doing a lot of traveling around Arizona? Or you probably have already.
I did when I worked for the Department of Behavioral Health. We went every road, I think, that exists there to meet with various providers. But at Copa, and I pretty much stayed around Maricopa County.
Well, that's good. So Mike, population health, can you just explain to people who might not understand exactly what population health is and what you do? I know that you've got another doctor that works with you on this, and how it helps our members.
Yeah, well, it's a term that is a bit confusing. It's a new term. It's sort of been created in the last 10 years. And population health studies the group of people we're meant to serve by using a combination of data analytics and utilization patterns, and working with clinical teams to understand the gaps in care that exist or the patterns of utilization that seem to be errant. And we do that on a routine basis, refreshing our database. We have what's known as a data lake, where the data is collected from various sources: our health information exchange, our payers, our own EMR, and that data is brought together in the data lake, somewhat purified so that we can combine things. And then the data is put together and matched so that we have information for a person. Then we do analytics. So the first part is artificial intelligence. Once we do analytics, it's assisted intelligence. So it becomes assisted intelligence when we analyze the data. And then the biggest part of my job is to make it actionable intelligence. So data, collecting data for data purposes is useful, but if it's not being used to do anything with it, it's going to what I refer to as a data graveyard, where we have lots of data, but no use. So my job is to make it actionable. And doing that, we meet with the teams on a routine basis, discussing cases or issues. And then creatively, the team, where we do brainstorming, comes up with an alternative that we can offer the individual that meets their needs better than what's happening right now. Rather than going into meetings using blamestorming and saying, well, you're not doing anything right, we go in assuming that we can capture the creativity of staff to do the right thing. And it's amazing the level of compassion and caring that I see from our direct care and our professionals at the clinics, and the great insights they have into how we can do better.
Yeah, I really like the thought of that. I hear about analytics so much, whether it's in sports or whether it's in traffic control or things like that. But what you're saying really makes sense, because you see patterns that probably wouldn't be very visible unless you collected this data. And then I know that you've been very instrumental in some cutting edge programs over the years, and you're able to implement things that will improve people's lives. I love that. So, as you know, May is Mental Health Awareness Month. And as a psychologist, as a doctor, what do you see as the most important issues right now with mental health? I mean, are we making strides in mental health with the populations that we serve, especially those who have serious mental illness?
We are making strides. There's no question about it. There are new treatments that are coming out all the time, new medications, longer term medications, so you don't have to take it medication every day or several times a day, that you can take it once every 3, and sometimes I think some of them 6 months. So we're making advances there. Therapies are improving. The pandemic itself created issues for individuals in terms of their ability to socialize with others. So we've seen issues of reemergence or emergence of substance abuse. We're also in the midst of the fentanyl or opioid epidemic. Overall, I think people are beginning to recognize more that mental illness or mental health is an important part of life. And mental health is something that more people are attending to, as the pandemic has brought us closer and cut our social networks down so that we weren't out, going to dinner with friends, or we were doing a lot of virtual things. But some things increased, as we could see. Anxiety was certainly something that people felt when they couldn't go out and do the things they normally do. But overall, stigma, by the fact that more people are recognizing mental illness as an important fact, is reducing. It's never going to go away, but minimizing it is important. So,
yeah, I've been lucky enough to be sort of a front row witness to some of the things that Partners in Recovery did, Mark Community Resources, and now Copa Health, things that basically were brought to the forefront and designed by you. I think of the Lighthouse project specifically, and things like that, and it really, really does make a difference. So I'm excited to be able to see that. And when you're doing the things that you're doing, it's always interesting as a lay person to be able to listen and hear about how the things that you're doing and your team's doing and Copa Health is doing, how it helps the people that we serve. So what are some simple things that you think others can do, our staff or members of the community, to make people aware and to promote better mental health?
Well, the key, and it's the key in treatment, it's the key in any relationship, it's engaging with an individual to not just lecture or preach about things, but to listen to a person and do it without judging, and to accept everyone's individual identity, and of course to recognize that everyone has strengths. Sometimes people forgot the things that they really succeeded in when they might have been in third grade and they hit, a home run, or they were in third grade and the teacher really liked what they created. So the main thing we need to do when we work in our field is to not forget everybody has strengths, and that sometimes we would bring a group of people together that were, in some sort of program we have, and we sat down, maybe we had coffee or lunch or something, and we would say, let's talk about Norm. Not exactly, but whoever. Let's talk about Norm. What do we like about Norm? And we would go around the room and people would say the kindest things about a person that they never recognized. That well, gee, I didn't know people liked me because I do this, or I didn't know they felt that I was kind, or that and when we left that meeting, that person was floating.
I love that. And I have to tell you, I think that people are their own harshest critics on a fairly regular basis.
They are.
And I think reminding them like you do, and thank you, Dr. Franczak, for mentioning that that's one of the things that you all do. I have talked to so many family members who have benefited from the things that you have done. And so I'm fortunate that I get to see tangible, results and tangible, basically testimonials to the work that you do. So I really appreciate that. But you're doing okay. How are you doing, coming through the pandemic? I know it's still going on, but it hit us all pretty hard.
Yeah, I'm doing fine. I'd like to get out more and do some more things, which is beginning to happen. I didn't like having to stay at home all the time. I don't think anybody did, but we all survived, or most of us survived through this, and I'm happy that we're into the new normal. I think pandemic taught us some lessons. There were some silver linings in it but overall, most people are going to be stronger. If it doesn't kill you, it makes you stronger, right?
Yeah. And the thing that I like about all that is, I always think about how many day-to-day improvements we got out of like the space program. Well, COVID actually did have some silver linings. I think that there's a lot of great things that were utilized and brought in because of COVID. So I really appreciate that. But thank you so much for being with us today, Dr. Franczak. I hope we'll get to see you soon again.
Yeah. Well, you guys have a great day, and I guess everyone have a great Memorial Day.
All right. Well, everybody, next week, the first Copa Roundup that we're going to have in June, and to kick it off, we're going to be talking with our good friend Kenneth Mack. Ken Mack has been on the Copa Roundup several times, and we're going to be talking about Juneteenth. And the more I learn about the history of Juneteenth, the more I learn about the way that it has become into the public vernacular. I'm just so impressed with Ken and the other things that he's talked about. So everybody stay safe. I mentioned this most weeks, but if you haven't gotten your vaccination for COVID-19 or your booster, go out and get it. I've got people reminding me all the time through text messages to get boosted, even though I am boosted already. And, also the flu shot, and in general, just try to take care of yourself. But we will see you all again next week, June 3rd, the first Friday of June. Take care.